Now I want to actually establish a link between tubulointerstitial diseases, alright, and how this type of diseases in the renals are able to cause chronic kidney disease. So tubulointerstitial diseases as a cause, okay, or as causes of chronic kidney disease. So first of all, we get to discuss what is tubulointerstitial. Of course, when you hear about tubulointerstitial, of course you are talking about all those proximal convoluted tubules, distal convoluted tubules. So you can have diseases originating from these areas. So over time, they can cause chronic kidney disease. So let's establish the link. So tubulointerstitial disease, we see that they are significant, but often when we are talking about causes of chronic kidney disease, we usually leave them out. Do you understand? So they can lead to chronic kidney disease in children. Okay. So these conditions, they primarily affect the renal tubules, the surrounding interstitial tissues, rather than the glomeruli directly. Do you understand? So it's the renal tubules that are mostly affected. So what's a tubulointerstitial disease? It's not one disease. It's different type of disease. Okay? There are different types. Okay? So they cause inflammation of tubules and the interstitium. They cause fibrosis, that's scarring of the kidney tissue. Alright? There's tubular atrophy. There's loss of functions of the kidney tubules. Okay? So over time, of course, they affect the kidney's ability to be able to concentrate urine, to be able to regulate electrolytes, to be able to remove waste. Then over time, they lead to chronic kidney disease. Okay. So issues, that's issues that could lead to tubulointerstitial disease. You have drug-induced ones. It could be infections. It could be autoimmune diseases where the body's own immune system is fighting the body's own tissues. It could be reflux nephropathy. That one, urine is coming to the bladder. How will I put it? Well, there's a backflow of urine. Do you understand? It could be in the tubules back to the nephron, or back to the glomerulus rather, okay, because tubules are part of the nephrons. Then sometimes it's exposure to toxins and heavy metals, alright, inherited disorders, then the tubulointerstitial nephritis with uveitis. That's what we have here, the Tinu syndrome. Okay, so clinical features is what such a patient is passing out a lot of urine, and they are passing out a lot of urine when they are in the night. That's nocturia. Mild proteinuria, so you can actually see proteins in urine. You know, normal or mildly elevated blood pressure. Okay, they are weak, growth failure, signs of CKDs in advanced stages. So diagnosis use urinalysis, blood test, imaging, kidney biopsies. Okay. The management, just most of the times, is something that is actually causing that issue. So try to do away with that thing that is causing that issue. Control blood pressure, control electrolyte balance, monitor kidney functions regularly. Then, if it is autoimmune issues, you can now give drugs to calm down the immune system. Okay, so that's what you have here for tubulointerstitial disease.